Hello, it's Dr. Rhonda Johnson. Today is Wednesday, May 11th, 2022. Today I'm talking about the 1 million people who have died from COVID-19 in the U.S. Now, I don't like talking about death, but you may have already heard about this because NBC News broadcast on May 4th that, according to their data sources, COVID had claimed the lives of 1 million Americans. Now, the official U.S. government death tolls on the CDC website, and as of May 10th, it stands at 998,408. So we'll probably hit the official U.S. government 1 million deaths next week sometime. Now, different data sources have different numbers, so don't get caught up with that because likely all of these deaths are an underestimate of the real death toll from COVID-19. Now, most of us can't even visualize 1 million dead, so I want you to think about this. The largest stadium in the United States is Michigan Stadium, part of the University of Michigan. Its official seating capacity is around 107,000. So using this as a visual, if you used, it would take 9 of these University of Michigan stadiums to hold the 1 million people that have died from COVID had they still been living. That's 9 football stadiums to get to 1 million dead. Now, I want to talk a little bit about these deaths. And again, it is difficult to wrap my head around this. But according to the CDC website, 68% of those deaths occurred in the hospital, 14% occurred in either nursing homes or long-term care facilities. And we know that COVID disproportionately impacted people 65 and older, because 74% of the COVID deaths were in 65 years and older people. 21% were people who were in the age group 45 to 64 years, according to the CDC, and 4% of these deaths were in the under 45 age group. Now, by race and ethnicity, 65% of the COVID deaths in the U.S. have been in whites, 16% in Hispanics, 14% in blacks, 3% in Asians, 1% in Native Alaskans, American Indians, and 0.2% in Native Hawaiians and Pacific Islanders. Now, sadly, there were more deaths in 2021 than 2020. And this is after the COVID vaccine rollout in the U.S. on December 14th, 2020, when that brave frontline nurse took that shot in New York City. And when I looked at the CDC death data tables, it was so painfully transparent that more people died during the time period after Thanksgiving 2021 to Valentine's Day 2022 than any other time during this COVID pandemic. Now, the CDC also officially states that more than 80% of the deaths from April to December 2021 were in unvaccinated Americans. So here we go. In summary, the United States has more deaths from COVID and the highest number of infections than any other country in the world. We are also one of the most highly vaccinated countries, and more people have been vaccinated with a Pfizer vaccine than any other vaccine. Now, with all these deaths comes a lot of grief and sorrow, and I don't want to try to minimize that, which is beyond the scope of this message. But we certainly know that there are ripple effects from all of this mental health and grief on our families. In fact, Penn State researchers in July 2020 said that every death from COVID-19 will impact approximately 9 surviving family members. And we know, again, that grief can last a long time. So, folks, what do we do? Where do we go from here? We know, at least for now, that the vaccines and the boosters still work. We know that masks work. We know that social distancing works. We know that crowd control, improving ventilation, limiting our presence in overcrowded spaces, all of this works. It's a no-brainer, but yet we can't seem to do it. We know that any mandates will be overturned. We know that lockdowns in this country will never happen again. So, folks, what are we going to do? We've got more contagious variants. We've got more immune-evading variants. And this virus keeps evolving. So how can we evolve as a country to avoid all of these excess deaths in the future. That's my message today. As always, my views are my own.